Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, August the 24th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday and Wednesday, we'll be providing written briefings at 3 p.m. And then on Thursday, there'll be another in-person briefing from Dr. Henry and myself starting at 3 o'clock. And with that, it's my honor, after a week, to introduce Dr. Bonnie Henry.
Thank you very much. Today we're reporting, of course, on the 3 periods since last Friday. Between Friday and Saturday, we had 109 new cases diagnosed with COVID-19. From Saturday to Sunday, there were additional 81 cases, and from Sunday to today, 79. For a total of 269 cases newly identified with COVID-19, and that includes 5 cases which were epidemiologically linked, bringing our total in British Columbia to 5,184 people diagnosed with COVID-19. That includes 1,651 in the Vancouver Coastal Health Region, 2,739 people in the Fraser Health Region, 166 people in the Vancouver Island Health Region, 425 people in Interior Health, and 127 people in the Northern Health Region. In addition, there were 76 people who reside outside of Canada. We now have 913 active cases across the province, of whom 18 are currently in hospital, 5 of whom are in critical care or ICU. Additionally, we have one new death to report over the past 3 days, bringing our total to 202 people who have passed away from COVID-19. And our thoughts and our condolences go out to the families and friends and also to the care providers for the people who have passed away. We have 4,068 people who are now fully recovered, and 2,594 people are on active daily follow-up with public health because they have been a close contact of a case. We have one new healthcare related outbreak in the Fraser Health Region, and this is at a long-term care home, the MSA Manor. That leaves us with 10 now active outbreaks in our healthcare system, 9 in long-term care or assisted living, and 1 in acute care. And we're up to 713 cases, 430 residents, and 283 staff. We have no new community outbreaks. There are, of course, ongoing community exposure alerts that are being posted on each of the health authority websites and on the BC CDC. And we continue to have flights where people with COVID-19 have been identified, both coming into and flying out of British Columbia. So please do check those websites if you have been in areas where it is a concern. On a positive note, the outbreak at Fraser Valley Packers has now been declared over. As we live with COVID-19 in our communities, our goals continue to be clear. We need to minimize our new cases through our own personal safety measures, those we take ourselves to protect our families, our communities, and those around us. We need to detect new cases as quickly as possible, and that speaks to the work we're doing in public health around the province, as well as ramping up our testing as we've been doing at testing sites around the province. And we need to respond just as quickly to contain the spread of the virus, and that again speaks to the work we do in public health to trace contacts, to make sure that we are connecting with those people who are at risk so they can be managed and so that we can be away from others if we develop symptoms ourselves. Despite the recent outbreaks and clusters that we have seen in the past week and the rising case numbers, we still have low undetected transmission in our province. We are able to find and connect most people who have this disease. But we want to keep it that way. We need to keep it that way as our summer continues and we look to the fall. It's about finding that balance, being able to live with this virus, but ensure that we are doing what we can to keep our society, our medical system, and our economy going. But it also means We all need to do our part to protect those people we know are more vulnerable to having severe illness or dying from COVID-19. And in particular, that's our seniors, our elders, and people in our families and communities who have compromised immune systems. Public health teams continue to closely watch our key indicators, and we are watching them every day to ensure that we are staying where we need to be. And it is a challenging thing to find this balance. We are monitoring the level of community spread, as well as things like the % positive of the tests that we're doing. As we know, we've ramped up testing to 4,000 to 5,000 tests a day, but our positivity rate remains relatively low, even though the testing is mostly focused on those people who have an exposure risk. So if we started to see that climb, that would worry us as well. Right now, we are staying within the range of where we need to be, although it is always fraught, and we all have to be careful to make sure we're doing our bit to keep us there. Our BC COVID-19 response is about all of us doing our part and taking the right precautions based on our circumstances. It's about protecting those around us and protecting ourselves. It's also how we've done this in BC by showing kindness and compassion, assuming the best and not the worst. If there's a cluster, if there's a case, public health teams are there, and we will continue to be there to manage. We are identifying close contacts and providing clear direction on what to do. While there are a few that have disregarded public health measures, the new enforcement rules are in place to shore up those gaps that have emerged. And we have maintained and changed and adapted the small number of public health orders that we have to address those situations where we are seeing transmission of this virus. We need to all continue to do the right thing from the get-go so that we don't need to use the enforcement measures that we have for our use now. Showing support for each other, assuming the best, and being an influencer for positive action is how we will get through this storm together. And there are many more months of this to come. All of us need to continue to adjust our approach as we learn more about the virus and tailor our activities to the circumstances we have before us. We need to stay strong, and we need to continue to use our basic steps, our layers, to live safely while COVID-19 is a part of our lives. We have the knowledge, and we have the skills, and we have the expertise to protect our most vulnerable amongst us, our elders, our communities, and ourselves. So let's keep going, doing our best each day, each and every day. And let's also continue to remember to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry, and on behalf of the Premier and the government, I thank everyone in BC. I want to join Dr. Henry in passing on my condolences to the family of the person who passed away in Fraser Health this weekend in long-term care as a result of COVID-19. The number of people is now over 200, as you know. The families who have gone through this in this difficult time have had to grieve in very difficult circumstances, and this will be the same in this case. And we want to say that we're with you, that we grieve with you, and that we understand the difficulty and the pain that this has caused to those families in particular. Dr. Henry has noted the cases over the weekend, and obviously that 269 is about 90 cases a day over the weekend. I want to acknowledge the extraordinary work of people in public health over the last 5 days who have done, I believe over the last 5 days, approximately 20,000 tests, which is the most significant 5-day period of testing since the beginning of the pandemic. 2,595 people who are self-isolating, and obviously the active cases and all the work being done in contact tracing and public health. I also want to acknowledge, because I see them as I think everyone in the audience does does in their daily lives. For me, it's at the Save On Foods on Marine Way and at the Safeway at Kingsway in Tyne in Vancouver, where I do grocery shopping. And I want to acknowledge the workers who have worked in that sector from the beginning of this pandemic and kept their stores open and kept their stores safe. I think the record of safety is really extraordinary, and it's really due to the commitment of those workers. I want to acknowledge them because we meet mostly for me in the weekends and the evenings, and because I think the people in that sector have really done extraordinary work on behalf of all of us, as we all need what's being sold in our grocery stores. But the workers, I had an opportunity as well to meet with representatives of workers, the UFCW Local 1518 this week, and I want to just acknowledge their extraordinary effort on behalf of all of us, and to say that we understand many people who are on the front lines of ensuring that everybody's kept safe in BC, whether they be those workers in grocery stores, other people in retail, people in the service sector, are doing extraordinary things, sometimes under very challenging conditions, and I want to express my appreciation to them today. Every Monday we provide an update on PPE and the purchase and the arrival of PPE in British Columbia, and this has been, as you know, a major effort, especially since March. So I want to recap first the cumulative totals since March, between over 6 million N95 or equivalent respirators, just over 47 million surgical or procedure masks, just over 2,400,000 pieces of eye protection, almost 84 million pairs of gloves, almost 5,900,000 gowns. And this week, in addition to that, we've received the following: 22,867 N95 or equivalent respirators, 2,368,300 surgical or procedure masks, 3,969,100 pairs of gloves, 1,583,980 gowns. We'll continue to source and test our PPE and are working to pursue any and all credible leads for safe and effective product, including working with other governments in Canada to increase our domestic capacity to produce the PPE that we will need in the future. In closing, I just wanted to say this, that obviously, while case counts have risen, our public health teams are continuing to work extraordinarily hard, and I think extraordinarily effectively, to meet that test. When case counts rise, I think the key for all of us is not to finger point, not to blame, not to worry, but to take the actions and recommit ourselves to the actions we've already taken, that we've shown are effective in dealing with COVID-19. That's our mission. Our mission is to stop the spread. Physical distancing saves lives and stops the spread. Following the rules established by public health officials saves lives and stops the spread. Respecting engineering safeguards saves lives and stops the spread. Adhering to administrative safeguards like gathering size saves lives and stops the spread. And wearing a mask where you're required to, asked to, and when lack of physical distancing makes it right to, saves lives and stops the spread. That's our duty, to stop the spread. So starting today, again, let's make sure that our actions when we're at home, in our neighborhoods, or out and about in our communities, let's make sure that our actions see us in the example we provide to others in stopping the spread. Starting today, let's make sure that when we see and talk to others or text and email them, our words encourage, welcome, and help them in their shared duty to stop the spread. Starting right now, we have one job in BC that leads all renewal activities, plans, and hopes. It allows for surgeries. It allows for us to resume important things like schools. That's stopping the spread. In our actions and our words, our message to ourselves, to those we love and care about, and to all British Columbians is this: stop the spread. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 21 à 22 août, celle des 22 et 23 août, et celle du 23 août jusqu'au 24 août, en mi-journée. Il y a eu un nouveau décès lié au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 203 personnes décédées du COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 4068 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, nous avons eu 109 nouveaux cas. Pour la deuxième période de référence, nous avons eu 81 nouveaux cas. Au cours des dernières 24 heures, 79 nouveaux cas se sont ajoutés. Cela représente 269 nouveaux cas depuis notre dernière mise à jour à vendredi pour un total de 5184 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 18 personnes sont actuellement hospitalisées, dont 5 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up only. Please also take your phones off mute. You will not be audible until I call your name. First question today is from Binder Sejjan, CTV.
Hi, Dr. Henry. I wanted to ask you about enforcement measures. This weekend, several police departments are telling us that they, issued warnings, but also some fines to people who are just not following the rules. I'm wondering what you think of that and what you think of the enforcement actions undertaken by the province.
Yeah, so, we've said from the beginning that we are focusing on giving people the tools and telling them what we need them to do and why, and focusing on supporting people to do the right thing. But we do know, and we've seen this, that there are situations where we know this virus is now being transmitted, and repeatedly. And we've talked about the concerns that we have, particularly around private parties. We made some changes to what happens in bars and restaurants, around events. We've made some changes to what people can do in vacation properties. And I think this is an unfortunate but necessary step to make sure that those small number of people who are breaking the rules, despite being warned, despite putting people at risk, particularly in our own communities, our own families, that we have some tools that we can use to support enforcement as well. So I think that is the right thing to do, and I think it's been used in the right way, very judiciously. We want to do it in a progressive way for those who really are breaking the rules intentionally.
Do you have a follow-up, Binder?
I do, and I guess a couple of the places were event spaces that were fined on the weekend in Surrey, and banquet halls are also saying that they either should be shut down so they're not put in a tough position with people who are booking their spaces, or wondering if you'd consider allowing them to have more people attend event spaces if they follow all the protocols.
Yeah, so we've had requests for reconsideration of the order around the number of people at events from the banquet community, and we've responded to them. And the answer from my perspective, given that I'm the one who wrote the orders, that it is like the events that we have in every other situation. And right now, for consistency across the board, we are staying at 50. And that is for a variety of reasons. It's one, to ensure that physical distancing measures can be put in place with that number, and that we can follow up with people rapidly with a small number if there's a small number of people who are potentially exposed. So there is a variety of reasons why we have stayed with that number consistently through the last few months as we've restarted, and there's good reasons for doing that. We've seen cases that have arisen in other places. We know when there's more people than that, the chances of somebody coming in with the virus and potentially spreading it go up dramatically, and we've seen what happens with that when we look at parties that were happening, for example, on the long weekend in July and again in August. We've also seen it at places like religious gatherings, and right now we have a number of people in the north who attended a large religious gathering in Alberta where cases were spread. So no, there's no opportunity in my mind right now. We need to continue to hold the line that we're holding, and that includes for any event, whether it's in a banquet hall, whether it's in a church, whether it's in a restaurant or a bar.
in British Columbia, we don't have a lot of rules, but this is one of the main ones, and I wouldn't expect any relaxation of it. The answer is to the request is simply no, not because we don't understand the value of banquet halls and the services they provide, but these are especially the kind of events that we have to address right now, and we've seen that as we look case by case through new cases, the need to continue to hold the line on public gatherings at 50, and that's going to continue to happen for a good long period in front of us. And I also want to say to people, in particular people who are hosting special events such as weddings, maybe parties such for hockey games and other things, that this is especially important for them. These are, of course, critical events in people's lives. Events such as weddings or stuff are events that one plans for, in many cases, years in advance. But it would be absolutely catastrophic and the wrong way to start a life together, to be involved in an event that spread COVID-19 right now. These are the rules right now, and they simply have to be followed. They have to be followed by everybody, and we'll continue to. I think we'll continue for some time, some significant time into the future, to say no to requests to relax those rules.
Next question is from Marcella Bernardo, News 1130.
Hi, everyone. Thank you for taking my question. For Dr. Henry, we at News 1130 have been inundated with messages from teachers, parents, and support staff confused about the current return to school plan, and they're mainly worried about physical distancing protocols. So if you could please explain again how many students will be allowed in the average classroom to ensure safety, because there's a lot of confusion about the pods and the protocols around that.
Yeah, so Marcella, my job is to provide the parameters, and we have done that with a whole group of teachers, parent groups, superintendents, principals, the Ministry of Education, and we've been involved from the very beginning of putting out the parameters of how schools can operate safely. And then it depends on every single school. So that is the work that has been happening. We know, and I've talked to many parents and teachers and principals and superintendents, and I got a great opportunity to talk to a lot of kids last week as well. So every school will be slightly different. It's like what we did for restaurants, for example, where we put out the parameters and the restaurants came and said, this is how we'll make it work in our setting, in our situation. So I can't tell you exactly what the number is going to be in every class. It'll depend on the school, it'll depend on the age of the kids, but we do have parameters, and the maximum number that children and teachers, so the maximum number includes both children and teachers, for elementary school is up to 60 that they might have distance contact with within a year or a semester. So that's not every day I'm going to be in close contact. We still have our physical distancing measures in place. We still have things like staggered times. For example, different classes may go out to recess together if they're in the same learning group, but they'll be in different parts of the schoolyard. They may have lunches at the same time, but in different areas. So the layers are still there, but the details need to be worked out within every single school and every school district, and that's the work that's been going on. I know there's a lot of really great innovative things that people have been doing to make this work, recognizing how important it is for our children across the board to get the education plus the social interaction of the school setting that they need right now. And we know that. We've seen the data from here and from around the world, the negative impacts that have happened with schools closing. So that's what we're focusing on. There'll be more details coming out later this week as the plans have come in from the different school districts and different schools. And I look forward to all those parents, and we're all anxious, of course we are. We need to learn how to live with this virus, and we in public health will be supporting doing that and making sure that those layers of protection are in place in our schools.
Do you have a follow-up, Marcella?
I do. I know that you've touched on this a bit about with the enforcement that's been happening over the weekend, but what will it take for you to start rolling back current openings if this new method of finding people doesn't work? Are you giving yourself a time limit for
how long are we going to let these numbers keep spiking before we take further action?
Yeah, so no, there's not a time limit and there's not one thing. What we've tried to do and what we will continue to do is look at where are we seeing transmissions happening, and we do that through public health. So we've seen it in certain settings in nightclubs, for example, and we added additional measures. We engaged with the people who work in that industry. We've shut down certain nightclubs when they have not been able to make those safety standards. So it's the same. We will approach it in the same way and take additional measures and adjust and modify as we need. You know, the shutting down is not an answer to things. What we need to do is figure out how to do all that we want to do in our society safely for the next year, maybe longer.
Next question is from Lisa Cordasco, CHLY.
Thank you. Just to pick up on that point, given when you just look at the numbers, simply the numbers, they're very high now. I'm just wondering what is different now compared to in May when we were seeing those numbers and we were in phase 1.
Yeah, so there's quite a lot different now than March when we took the actions that we did to stop things. We know a lot more about the virus. We know about how to find people. We know about how it's transmitted. We know that the measures that we take work, and we see that every time. If we look at the outbreaks that we've had, for example, in workplaces, in small communities, when we detect people quickly, when we monitor quickly, when we put in place the measures, we're able to stop the transmission. We didn't know how much was circulating in the community early on in March and into April. We didn't know how to best manage in places like long-term care. We didn't know the settings that we were going to see transmission. So the things that we have in place now, particularly here in BC, you know, the fact that every business that's open has to have a COVID-19 safety plan. That means that everyone has to think about what are they going to do to make their environment safe. You know, we've done it here at the legislature, we've done it in restaurants, and it's what helps us work together about how to open up our society, our economy in a safe way, and it mostly works. And then we're here in public health to find the people where transmissions are happening and to take the measures that we need to try and reduce those. So we will continue doing this. We need to learn that this virus is going to be with us. We've seen around the world, even New Zealand is not able to stay isolated from it. And we here in BC are next to our country to the south where there's still a tremendous amount of transmission. So we need to continue to be on our guard. We have people moving back and forth into the province for essential travel. We know that some of them bring this virus with them. We know that people are moving between communities. They're going into work. Sometimes they may not recognize that they have these symptoms. So we need to be able to manage outbreaks, manage clusters in our community like we do with other viruses every year. And that's what we need to focus on now.
Do you have a follow-up?
Yes, I'd just like to ask about the cases in the Island Health region. As far as I understand it, most are community transmissions, and if I do understand correctly, that means the actual source hasn't been tracked yet. Is that a concern?
I'm sorry, I didn't hear the first part of it. You said in which community?
Island.
Health. My understanding is that yes, they are cases that have arisen in the community, but absolutely, we do that trace back to find out where somebody was potentially exposed. And I'm not aware that there's any on the island, maybe the most recent one or two. Sometimes it takes us a few days to find out where people have been exposed. But that's the work of public health, and we've been doing that very successfully. And we're still in the high 80s to 90% of being able to find close contacts and to be able to find and link cases here in BC. So that's something that we're watching very carefully. Unlinked cases and rising numbers and percentages of unlinked cases are things that concern us. So my colleagues here in Island Health and in the Lower Mainland around the province, those are the things that we fuss about and we talk about all the time. And we have really, I mean, this is why you can't replace people who do the work of public health with an app. We know how to talk to people, help them through this, make sure they get the care they need, make sure that people who are exposed know what to do if they get sick. And that's all takes personal connection. And that's how we find out and how we link cases and how we try and stop those chains of transmission. So far, we are doing that quite effectively across BC.
Next question is from Mike Hager, Globe and Mail.
Hi there. Thanks for taking my question. I want to know if you have any concerns over ventilation in classrooms. The Education Ministry has given high-level guidance. Wondering what Dr. Henry thinks of those plans and whether she was consulted.
So ventilation is, of course, something that we see is really effective. We know that if you're outside, the risk of transmission is considerably less than inside, even if you're having contact with people. It's not zero, but it's much less risky outside. And we've said that from the very beginning, where we've encouraged people to go outside. Maintain your distance, but go outside. We know that it's the virus is destroyed by UV light. We know that natural ventilation, so being able to open windows in schools, obviously not always possible, but those are things that can help disperse any virus that might be there, so that it is not concentrated enough that it can infect people. So ventilation is important. I haven't seen specific school by school plans, but I know that is something that we've said is an important thing for each school to consider and each classroom to consider how they can do that, whether it's having classes outside, having more activities outside versus inside, especially at this time of the year and early in the fall, and other ways to increase natural ventilation. I think the other thing that's really, really important that we need to remember about our schools, it's very similar to what we do in our healthcare system, is that the number one thing that protects us, it protects us if we're going to see our hairdresser, it protects us if we're going to a retail store, is that every single day, every student, every adult who goes into a school has to be assessed, whether it's your parent asking you if you're feeling okay and affirming. We've done it, there's several different ways that people are doing it, but making sure that anybody who's not feeling well is not coming into the school. That's really the important first line of defense that we have, and we know that that works. So ventilation is one of the important things, one of the layers that can help as well.
Do you have a follow-up, Mike?
Yes, thanks. Thanks for that. I'm just wondering what the current proportion of new cases, just how the ages break down, whether sub 40 adults are still driving these new infections that are being found, and why are nightclubs and bars still open. I talked to some operators who admit that it's extremely difficult to enforce these rules once people have more than a few drinks, and public exposures are still happening at these lounges and bars. What's the rationale? Is that you don't want to drive this partying further underground where it's harder to police these rules?
That's one of the reasons. So yes, we're still seeing that it's being driven by younger people. We are starting to see a bit of an increase in people 50 to 60, for example, and we know that some of that is workplace transmission events that we've seen. Some of it is transmission within family groups that have caused issues, and in healthcare settings. So healthcare workers being exposed to somebody who may have been at a party, for example, and then going into work. So it's a mix, but it is still being driven primarily by younger people. And yeah, there's a lot of reasons. If we look at when businesses were shut down, the people that were most affected were obviously in the hospitality industry, and many of those have not recovered. So we want to find a happy balance. It's those as much of a balance as we can. The vast majority of restaurants, bars, clubs are doing the right thing, and they're doing it effectively and safely. And it gives employment to young people. It gives venues where people can safely gather together and celebrate the Canucks, for example. But there are some people who are finding it challenging, and that's where we can help with enforcement. But we do know that if we just shut things down, and we've seen that happen in other countries around the world, that they do tend to go underground where they are less controlled. They can cause more challenges, more difficulties, and people are less likely to report if they're feeling ill, or to let others know if they're not feeling well as well, and to go for testing. So it's finding that balance. We need people to trust us. We need to make sure that people have those opportunities, especially young people, where we know that drive to have social interaction is so strong and so important at that point in people's lives. So we want to support people to do it in a safe way. And I mean, really, how often do we get to sit outside on an August night and watch the Stanley Cup finals? I think we should be having street parties where everybody is clustered several, driveways apart, and celebrating the Stanley Cup finals over the next couple of weeks, especially with the Canucks in.
Next question is from Cindy Harnett, Times Colonist.
Hi, thanks for taking my call. Island residents continue to call the Times Colonist that they can't get through to Island Health's call center. Island Health says the wait can be up to 90 minutes, but people are telling us it's longer than that if they don't abandon the call altogether. Is that acceptable, and is there concern about people who may be think they have COVID-19 but are abandoning their attempts to get a test?
Yeah, I understand that there has been some concerns, particularly in the last week in Island Health, around access to the call line and getting appointments or being able to get testing. I know they're working on that. There's been a new testing center established. So it has been a challenge. What I will say is that we know that if you have symptoms, you should be staying away from others. So please understand that these challenges sometimes arise. I know they're working on it, but do stay away from others if you continue to have symptoms, and you will get a test as soon as they can work these out. I know that's been a challenge.
I understand, Sydney. We'll be in touch with Island Health again about those concerns. I would note that the 811 line, which is our central response line, it goes up and down with both anxiety around COVID-19 and with actual cases around COVID-19. It peaked in terms of number of calls received in the month of April, when we did, I think, one day when the nurses and other staff at 811 did more than 5,000 responses on that day. The pre-COVID average was about 1,000, just to put that in context. We've done, in this past week, there have been about 2,700 to 2,900 calls answered, and that's how many calls have been received. The average wait time at 811 in the last number of days, I checked before I came here, is very small. It's nothing like 90 minutes. It's nothing like 90 seconds. It's been under, on average, 90 seconds. So, there are ways that one can reach out and get information and get help. And the people at 811, like the people who are working on testing, like our contact tracers, like everyone in public health, has been working flat out. And I think there are times, I think from sometime late in July to early August, we saw an increase in the number of calls we got. And for a couple of days, we had to have more people on to respond to those calls than we did. But the wait times over the weekend on 811 were exceedingly low, and they continue to be low. We have a small number of people who abandon those calls. So that is another place people can go to get information, and we have extraordinary staff, and to get support and to get advice and to get help. We have extraordinary staff working there.
Cindy, do you have a follow-up?
I do. Thank you very much. I will note, though, however, Minister Dix, that while they can get through to 811, in Island Health, of course, they need to talk to the call center to book an appointment, and they're not able to do that, as I understand, through 811. But my second question would be, in terms of an increase in visitation to long-term care homes, there was a thought that if it was successful, that perhaps it would open up to perhaps another family member, or more frequent visits, perhaps. Is there going to be any changes there, and how is the system working to date?
Yeah, I can tell you, and as you know, I've been away for a week, but discussions have been ongoing about that. We wanted to give a period for people to adjust, to get those initial visits in, to make sure that people were comfortable with the protocols, and we are absolutely relooking at that.
And what we wanted to put in place, Cindy, was a system, and we did that on June 30th, or with guidelines on June 30th that could be put in place right away, and they have been. And every care home, assisted living home across BC, visits are taking place except in those facilities, except on Haida Gwaii in recent times, during the incidence of transmission there, and in the care homes that are under outbreak protocol. We put together the system for two reasons, and that's one designated visitor a week, to ensure that that can be managed with the other pressures on the care homes to keep people safe and to make sure that visits took place. What's also happening now is a process to add and support people to visit, and the expansion of that visitation will be partly the result of the review we're doing of visitation now, and partly will be greatly aided by the additional staff that will be provided to support care homes across BC in managing that visitation in the coming months. You recall that we provided to care homes for the period April 1 to June 30th, I believe, approximately $26 million retroactive. That the visitation plan is supported by $160 million in funding. That the single site plan, which is critical to keeping people safe in long-term care, and is a lesson that BC, I think, has demonstrated well across Canada, is a cost item of about $165.7 million. So those items are significant investments in long-term care. But we're going to do the same thing we've done with everything else, which is be methodical, be prudent, and to test out what we're doing before we move on to the next step. And that will be the same in this case.
Next question is from Keith Baldry, Global News.
Hi, Dr. Henry. Welcome back. Just a question about today was announced that sports leagues and associations can get active now in phase 3 with safety guidelines. We were hearing from some anxious parents wondering how that squares with their cohorts of 60 or 120. Now they're going to be in a sports league with other people adding to that number. I know you're a big proponent of physical activity in sports. What could you say to alleviate some of those concerns?
Yeah, and I think, every family will have to make those decisions based on their own circumstances. But the next phase of opening up to some sports is not about expanding large numbers. It's about being able to have local teams play each other. So it's still a very controlled phase. And we expect that the vast majority, there will be minimal contact, and that many different sports will be at a different pace. And, we all know how important physical exercise is, and the team environment for the growth of youth, but also for adults who are in those environments as well. So it's not a full-on back to tournaments. We won't be having people traveling around the province, for example. It'll be some local competition and some more, still, I believe, in a safe way, increased team contact.
Do you have a follow-up, Keith?
No, that's good. Thank you very much.
Thank you. We have time for one more. We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released shortly. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. Last question is from Tina Lovegreen, CBC.
Hi, Dr. Henry. I'm wondering if you can give us an update on testing procedures for workers in long-term care facilities. Are staff tested regularly for COVID, and if not, why? And can you also just clarify the BC death total? Is it 203 or 202? Because I think Friday it was reported as 202.
Okay, my mistake. My notes had said there were 2 additional deaths, and I knew there was just 1. So, but you're right. I misspoke. The actual total is 203, unfortunately, people who've died in BC. So, and there now I was distracted and completely lost the first part of your testing and long-term care. No, what we do and what we have done from the very beginning is it's about screening. It's about self-screening active screening of everybody who goes into a long-term care or a hospital or a healthcare facility every day. So that means that I need to do a check and make sure, and I have to visibly walk through each of the symptoms that I could possibly have before I go into work. There's very low yield, and we've seen that in other provinces and other countries where they have done ongoing testing of asymptomatic healthcare workers on a periodic basis. That is, in my mind, not a great use of resources. We know there's false positives and we know there's false negatives. So what we are doing is focusing on the daily symptom screening that everybody must actively do, and is a very similar thing we'll be doing for schools as well. If anybody has symptoms, then testing is immediately available, and we have protocols, as you are aware now, where if a single case, either in a resident or in a healthcare worker or a visitor, is identified, then we have wide screening in that facility of everybody to make sure that we're picking up any potential cases once there's a real risk. So it's a little bit about understanding the parameters of the test and where it can be very useful for us without unnecessarily doing tests that aren't going to help us.
Do you have a follow-up, Tina?
Yes, please. And what is the protocol for notifying family members of residents in long-term care if someone in the care facility is infected? And if we could also possibly get that answer in French.
Sure. So we use the same protocols that we have on an ongoing basis for influenza outbreaks and other outbreaks. In this case, our sensitivity level is very low in that a single individual, and so each facility has a process for notification, and it's done in partnership with the health authority should a case arise in that facility, and we declare it as an outbreak with a single case. And each of our health authorities now has become very adept at making sure we have a team that goes and supports the facility to manage an outbreak. And you will have noticed that some of our more recent outbreaks have been limited to a single case, either in a resident or in a staff member, and that we're able to manage those outbreaks very quickly. So the notification protocol is part of the outbreak response that's done through both the health authority and the facility itself.
Oui, ce travail, c'est un travail d'équipe entre le centre de soins et la régie de santé en question. Et bien entendu, pour déclarer une situation dans un tel centre ou un autre, il ne faut qu'un cas. Donc, on a plusieurs, je pense 5 actuellement, qui n'ont qu'un cas parmi quelqu'un qui travaille pour la facilité. Et on voit beaucoup plus de cela à cause des efforts des équipes qui travaillent pour réduire la transmission dans ces circonstances-là. Donc, c'est un partenariat entre le centre de soins et la régie de santé. Et c'est une partenariat qui travaille très efficacement à l'heure actuelle. Et bien entendu, quand il y a une question dans un tel centre de soins, tout le monde, toutes les familles sont notifiées après pour que tout le monde puisse savoir ce qui se passe dans le centre. Merci beaucoup. Thank you very much.
Thank you.
We'll see you Thursday.